My name is Pamela Allen. I am a hematologist at the Winship Cancer Institute of Emory University, and today we're going to be talking about Belinostat, which is a targeted agent that's used in several malignancies, and we performed a meta-analysis looking at the safety of this drug as well as how effective it was in all malignancies. Initially, we were really trying to look at patient-reported outcomes, but we found that there was actually no patient-reported outcomes with Belinostat in any clinical trial. So in order to assess what symptoms are related to Belinostat, we performed an efficacy analysis that looked at Belinostat in all malignancies, and we secondarily looked specifically at relapsed peripheral T-cell lymphoma to see how effective it was in that disease. We looked at a total of 16 studies for the safety analysis, and this included over 500 individual patients. The analysis demonstrated that patients had side effects that were very similar to what you would normally see with chemotherapy: nausea, vomiting, and diarrhea. But importantly, the rate of patients that had hematologic toxicities, which means lowering of the blood counts, was very rare. Overall, patients had less than 10% effect on the blood count, and for the white blood cell count, the effect was less than 5% and less than 1% that ended up getting an infection because of the low counts. We weren't surprised that there wasn't a big impact on the blood cell counts with Belinostat because that was what was reported in the trials of relapsed peripheral T-cell lymphoma. But when we looked across all malignancies, including those 500 patients, we found that it was really the same in all different malignancies. And so that gave us a lot of confidence moving forward that this is what we could expect to see if we treated our patients with Belinostat. So I think in the future, this is definitely a promising drug. It has some limited efficacy, but about similar to other drugs that are used in relapsed disease. But it could potentially be combined with other agents to improve that efficacy without significantly affecting patients' blood counts.